Hello, and welcome to Authority Health GME Consortium's 2020 Celebration of Residency Completion. My name is Angela Cole, and I am the Administrative Director for Graduate Medical Education. It is my pleasure and honor to welcome you to our virtual celebration in honor of our class of 2020. Unprecedented times calls for extraordinary responses, and we have all taken these challenging circumstances head on, quickly making the necessary adjustments to meet the needs of those Authority Health has vowed to serve. And graduation in this format is no exception to the quick adjustments we have all made. We have gathered congratulatory videos as an acknowledgement of this very great accomplishment and milestone in your growing careers. So please enjoy the messages. I wish you all much success, prosperity, and good health. Take care, keep in touch, and with that, I would like to present to you our DME DIO, Dr. Ernie Yoder. Dr. Yoder.
Thanks, Angela. Welcome, everyone. I'm honored to have worked with all of you for the past 2 years, and I want to thank you for your compassion in serving our patients and their families. I also want to thank you for your spirit of volunteerism and for your courage in facing the COVID-19 pandemic. I want to thank you for persisting as we swabbed hundreds of our neighbors in order to make the diagnosis of COVID-19. I would like to remind you of the uniqueness of your preparation for practice. Through our community-based program, our population health certificate, and community medicine rotation, you are well prepared to meet the needs of individuals and communities wherever you decide to practice. And let me say parenthetically, we hope you choose to practice in physician shortage areas and to take jobs with our federally qualified health center partners. I hope you will never forget your colleagues and peers as you move on in our profession. I challenge you to continue to live our values, assuring access to the underserved, remaining accountable for quality and safety of healthcare, promoting diversity and social justice, partnering with community organizations and agencies to provide great care for your patients and communities, and for committing to preventive care for all of your patients. Those are the hallmarks of Authority Health. Please continue to listen to your inner voice, that voice that urges you to take action on behalf of your patients and your community, wherever that may be. Finally, I want to thank you for helping us to achieve our mission of assuring the healthcare safety net for residents of Detroit, Wayne County, and Southeastern Michigan. I'd like to leave you with 2 quotations, which I think were appropriate for graduation. First, from Tom Brokaw, noted broadcaster and newsman. You are educated. Your certification is in your degree. You may think of it as a ticket to a good life. Let me ask you to think of an alternative. Think of it as your ticket to change the world. And we need that more than ever. And finally, from the philosopher Lao Tse, watch your thoughts. They become words. Watch your words, they become actions. Watch your actions, they become habits. Watch your habits, they become character. Watch your character, it becomes your destiny. Thank you very much. And it's my pleasure to introduce our President and CEO, Mrs. Loretta Bush.
Thank you, Dr. Yoder. Good afternoon, everyone, and congratulations to all of you for completing your Authority Health Residency Training Program. This is indeed a career milestone for you as physicians, and it's an important moment in Authority Health's commitment to prepare the next generation of physicians for community-based, culturally competent primary care. You began your training expecting a challenging experience in a medically underserved urban community. You have treated thousands of people who may have seen a doctor for the very first time, or for not in a very long time. You have seen that chronic diseases that affect much of our population, and you have come to understand the importance of how social determinants of health have a real impact on health outcomes. In addition to all of that, from your population health program, we hope that you have gained a greater appreciation of health disparities, psychological trauma, and the social inequities of the populations that we serve. It is our hope that this understanding will continue to guide you, not only in the practice of medicine, but also in your personal interactions. Because as Dr. Ernie has already said, this is how we truly begin to change the world. Now, this has been a unique training opportunity, which is available at only a few centers across the country. Hopefully you understand and truly, fully appreciate the value of teaching health centers in medical education. In applying for the privilege of hosting this important program, Authority Health committed to providing a challenging training experience. Now this year, we all also had an unexpected challenge. That challenge is the novel coronavirus pandemic. As frontline primary care providers, you were called on to create a safe environment that allowed you to maintain your connection with our patients through virtual health technology. While primary care providers closed their practices in urban Detroit, we remained open and we adapted to the pressures of this pandemic. To those who served at Popoff Family Health Center and those who supported the pediatric practice of Dr. Ann Maria Ice, we are deeply and forever grateful. Many of you have contributed to our community-based COVID-19 testing program. In the past month, we have tested over 100 adults and children, contributing to the broader goal of testing everyone who wants to be tested. Some of you have had to endure the effects of COVID-19 yourselves. For that, you are certainly deserving of our thanks, and we are grateful that everyone in our Authority Health family made a full recovery. Teaching health center residents in Detroit and throughout the nation have demonstrated great courage and commitment, and for that, all Americans, we should be proud. Now, I'm going to turn my attention to workforce development and community service. Workforce development is one of the 4 pillars of the emphasis in the mission of Authority Health, specifically the primary care workforce in medically underserved areas like Detroit and communities in Wayne County, which are critically undersupplied with physicians. The National Center for Health Workforce Analysis projects a shortage of over 23,000 primary care physicians by 2025. While we remain committed to training physicians that may practice in other parts of our great country, we are very pleased when our residents decide to practice in our own Metro Detroit community. Please join me in celebrating the addition of Dr. Jasmine Gray, who will be joining the Authority Health pediatric practice, serving children and adolescents in Northwest Detroit. She will join Drs. Emily Casterline and Allison Trippy, both of which also are graduates of the Authority Health residency program. While training more primary care physicians is vitally important, resident training provides a lot of health care that may not have been delivered otherwise. During the 2018-19 academic year, our residents collectively treated a total of 40,786 patients. That averaged across 71 residents. That would be 575 patients seen by each of our residents. I have to tell you, that is real community impact. COVID-19 has confirmed why community-based primary care is so important for underserved and vulnerable populations. The numbers are critical indicators. Let's take a look at Michigan. In Michigan, African Americans account for 14% of the population, yet 37% of the COVID positive patients were African American. And of those, 47% of the COVID positives that died were African American. We know that obesity and chronic disease are major factors that contribute to surviving, whether or not you survive COVID-19. We also know that access to care and social bias are among the other contributing factors. Now, you have had a unique training experience. We are pleased to have offered that training opportunity that provided you the same clinical challenge of larger programs, but also with the intimacy and personality of the local community. Some of those unique attributes include having our own continuity clinic, but located at the Popoff Family Health Center and the Pediatrics LLC practice, as well as our FQHC partners and the mental health centers in our communities. This increased the breadth of your experience, and we hope provided a more genuine practice experience versus one that was only highly academic. Then there's the population health program, certificate program. This provided you with a much deeper understanding and knowledge of the community dynamics and the social determinants of health that affect our patients. You gained insight into the many non-medical factors that affects a person's health. You also received valuable training in quality improvement and patient safety. And then I'm very pleased to say this last point. We heard you, and having heard from you, we look forward to adding curriculum to address systemic and interpersonal racism in medicine. At this very tense period in our country's history, and as we carefully restore our social and economic functions following the 3-month COVID stay home, stay safe, we are faced with evidence of health inequity in the mortality rate of African Americans and social inequity, most recently evidenced in the fatal force inflicted on George Floyd, Ahmaud Arbery, and Breonna Taylor. We say their names out of deep respect and out of remembrance. Racism, violence, and social inequity is a public health issue. And we know these are issues that impact the health and the well-being of marginalized populations. As physicians, you have been trained to diagnose and to heal. You have been trained to understand the social determinants of health. You know that a population that fears their safety in the face of law enforcement day in and day out cannot be expected to achieve optimum health. You know that a population that must take 2 buses to an underpaying job will have trouble getting to medical appointments. You know that low-income people living in unsafe neighborhoods may have trouble exercising and certainly are not likely to join and belong to health clubs. You know that someone who is homeless or lives in substandard housing will have health challenges. And you know that children who don't eat well don't learn well. You know that these are problems that we collectively have the power to influence midstream. You may not have the time or the resources to impact the broader systemic problems of society, but you can help people in your local community. These are the people you have been trained to understand and to treat well. You may establish your practice in urban Detroit or in rural Monroe County. Wherever you work, you will surely find people that come from the circumstances that I've described. Wherever you settle, you will be busy as a primary caregiver. Most likely, you will not be compensated for the value that you bring to our society, unlike other specialties. So you will have to work hard. Try to find time to give back to the communities where you live and work. Do what you can to correct the problems that create an unhealthy environment. We know that you won't just provide sick care, but you will also promote wellness. Believe, we believe, and we want you to believe that you are prepared to help create healthier communities. Now you are about to enter the next phase of your career. In a sense, you are entering the true challenge when professors and preceptors no longer assess you, but you are assessed by your outcomes and your dedication to health and healing. You now must make the best use of your training and knowledge, the knowledge and training that you have gained both in medical school and in our residency program. No matter where you settle, we hope that you will remember your years in our beloved Detroit and remember the people that you have come to treat and the social determinants that impact their health. Remember the vital role that primary care played and continues to play during this pandemic. We hope that you will remember that you had an opportunity to train in a teaching health center. Tell people that you trained at Authority Health in Detroit, but also tell them that you trained in a teaching health center and why that's different. We need you to continue to advocate for continued support in Congress so that other medical students interested in this unique experience will have the same chance to have this experience. Now I'd like to turn my attention to our Best of the HealthNet Award. Before I conclude, I want to recognize one of you for your outstanding contribution to Authority Health. Each year, Authority Health identifies members of our community and our Authority Health family who have provided extraordinary service on behalf of our mission. This award is typically given during our holiday celebration in Detroit in December. However, this year, we wanted to honor one of our graduating residents, Dr. James Sung. Throughout the COVID-19 pandemic, our residents have performed exceptionally and exceedingly well, risking their own personal well-being to care for patients at our Popoff Family Health Center, as well as Pediatric LLC and other primary care and hospital sites. Early on, several of our residents and staff working at the Popoff Family Health Center became ill and unable to work. Dr. Sung demonstrated extraordinary service for more than a week, providing administrative as well as clinical support, often as the only staff person other than faculty and the administrative staff. This was also a very hectic period in which we transitioned from face-to-face medical care to telemedicine. Dr. Sung has been an effective practitioner, utilizing our virtual health software and helping to train other residents, faculty, and staff in the use of this technology. He has also worked with staff to devise and improve the technical and patient care process changes that were key to a successful transition to virtual care. Dr. Sung is completing his family medicine residency, and that is that Dr. Sung is a humble and quietly effective clinician. And so right now he's probably embarrassed that he's getting all of this attention, but it is well deserved. Dr. Sung provides compassionate care to all patients and families served in our Eastside Detroit facility. Dr. Sung has demonstrated a thorough understanding of the social determinants of health and the impact that they have on the patients, and he works to address these factors. I would like to thank both Dr. Ernie Yoder and Mrs. Patricia White for nominating Dr. Sung to receive the Best of the Health Net Award, which is our way of formally honoring those within the Authority Health family who have demonstrated alignment to our mission. Dr. Sung, we applaud your achievement. Now I'm going to end with a quote. And this is one of my favorite quotes. It's from James Allen. And I think it's appropriate for today because those of you in the residency program, you have had many achievements in your life. You have dreamed many dreams, but you still have more becoming to do. So with that, let me give you the quote from James Allen. And James Allen encourages us. He says, dream lofty dreams, for as you dream, so shall you become. Your vision is the promise of what you shall one day be. Your ideal is the prophecy of what you will at last achieve. On behalf of the board and staff of Authority Health, we congratulate all of you and we wish you well. And now please enjoy your graduation presentation.
On behalf of the College of Osteopathic Medicine at Michigan State University, I'd like to congratulate the class of 2020 graduating from the Authority Health residency programs this year. I can't think of a more unique group that you have faced challenges that many would not have handled with the grace and grit that your group has, not only for the residency times that you've spent, but also these past few months supporting your friends, family, colleagues, and profession of medicine during no less than a COVID pandemic. We certainly are proud of you. We know you're going to do great things going forward as a result of all your training and what we've seen from you already. Those places, those venues where you're going to be going next are truly lucky to have you. So again, on behalf of the College of Osteopathic Medicine, congratulations, class of 2020. Well earned, good luck, and go green. Take care. On behalf of the College of Osteopathic Medicine at Michigan State University, I'd like to congratulate the class of 2020 graduating from the Authority Health residency programs this year. I can't think of a more unique group that you have faced challenges that many would not have handled with the grace and grit that your group has, not only for the residency times that you've spent, but also these past few months supporting your friends, family, colleagues, and profession of medicine during no less than a COVID pandemic. We certainly are proud of you. We know you're going to do great things going forward as a result of all your training and what we've seen from you already. Those places, those venues where you're going to be going next are truly lucky to have you. So again, on behalf of the College of Osteopathic Medicine, congratulations, class of 2020. Well earned, good luck, and go green. Take care.
Hi, my name is Phoebe Kulik, Director of Workforce Development with the Certificate in Population Health and Health Equity at the University of Michigan School of Public Health. While I'm sorry we can't be in person together to celebrate, we're happy to congratulate you on your graduation from residency. It's been a pleasure working with you through the certificate program and getting to be a part of your experience at Authority Health. Our team would like to share a few remarks.
Well, we've come to the end of our sessions. It's been great to have an opportunity to work with you. I hope this has been, a learning experience for you. I know way back when I went through, medical school, I think I would have benefited tremendously from having some exposure to the social determinants of health and some of the other discussions that we've had. So hopefully you feel that this directly informs the work that you do, and that you look ahead towards building, on what you've learned as part of this certificate program. It's a weird time, having to meet like this because of the COVID-19 situation. I've mentioned before, I was at the State Health Department for a number of years in charge of communicable disease control. And we went through some trying situations like West Nile and SARS and 9/11 and the anthrax mailing, but nothing that really, compared to the magnitude of COVID-19, which has also directly affected all of you as physicians. And it really calls for a different level of integration between, public health and medicine if we're going to effectively address new and emergent diseases that are likely to come on the scene with increasing frequency for a number of reasons. All of us need to become advocates, because you've been on the front line of this COVID-19 situation, and you've seen the fallout from that. And I think all of us need to collectively ensure that our nation does not experience something like this again. And I do feel that that's doable if we're prepared and if we're proactive. But it's going to require all of us to be advocates for that, both internally and externally, to ensure that something like COVID-19 never happens to our nation again.
Well, I'll just make some brief comments. First, I just want to say I've had a really good time getting to know all of you these last 2 years. I want to thank you for your hard work. I recognize that residency is a really challenging time, and you're being asked to do a lot and to...
Hello, my name is Kathy Smart, and I'm the Family Medicine Residency Coordinator. On behalf of Authority Health's Graduate Medical Education's residency coordinators, we hope that your time at Authority Health has been one that you will always look back on as a journey that developed your character and ability to be the best doctor. Together, we have overcome many challenges, and here we are today at the end of your journey of residency. To add to the unexpected drawbacks of residency itself, who would have imagined being faced with the unexpected, strenuous task of surviving a pandemic? From family medicine to internal medicine to pediatrics and psychiatry, there was an impact on each program to some degree. Such a time as this may have been the furthest thought from the minds of many of you when you decided medicine as a career. One thing's for certain, and two things for sure. Whether the thought came to mind or not, you all have been soldiers in the battle against COVID-19. As frontline workers, you've positioned yourself in the trenches, never allowed defeat to overcome you, and at times barely came up for air. Your dedication and commitment to give your all to those in need of healthcare on a regular basis, as well as the demanding times of the current pandemic, has not gone unnoticed. Your hard work is and will always be greatly appreciated and remembered. No matter the work that we face on the administrative end as coordinators, we find it to be a very rewarding experience to have been a part of such an achievement that you all have accomplished. With that, we extend our congratulations to you, as it has been an honor to work with you over the years. Good luck to you all on the next chapter of your career.
Good day. My name is Dr. Thadia Carey, and I am the Psychiatry Residency Training Director of Authority Health GME. Every year we have a couple of residents leaving us after completing 3 years to pursue fellowship training in child and adolescent psychiatry. This year is no different. We have Dr. Danielle Keaton leaving us to go to Michigan State University. And we also have Dr. Peggy Smith leaving us also for Michigan State University. And now to our graduates. First up is Dr. Andrew Lister. Dr. Lister will be taking a position in private practice in Fort Myers, Florida, in order to do TMS, which is transmagnetic stimulation. Dr. Lister reports that he would not trade his training at Authority Health for any other training program.
We love you, Andrew. Oh, yes, we do. We love you, Andrew, and so proud of you, too. Graduating psychiatry residency made your dreams come true. We miss you dearly. We really do. Oh, Andrew, we love you.
You imagine with your mind and believe with all your heart. Today, you achieve with all your might. Congratulations on your medical residency graduation. We are so proud of you.
Love, Mom,
Dad,
and Lucy.
Our final graduate is Dr. Fallon Fagin. Dr. Fagin will be taking 2 positions in Houston, Texas. One full-time position at the Harris Center, which is a community mental health center, and part-time at Baymont Behavioral Health. Dr. Fagin reports she's excited to continue working with the underserved in Texas. And she reports, my experience in my training at Authority Health has greatly influenced my choice to pursue full-time position at a CMH.
We're the proud parents of Dr. Fallon Danielle Fagin, and we're just here to say congratulations, Fallon, for the great accomplishment you just made.
We are so proud of you, and we know that you will be a blessing to all of the patients that you serve in the future, just as you have always been a blessing to me and your dad. We love you.
Love you, sweetie, and congratulations again.
Congratulations, Dr. Fallon Fagin. We are so proud of you. 8 years of medical school and post-conviction work, and you've just flown through them. We've watched you go from a young woman and just blossom into a wonderful professional and a beautiful young lady. We are so proud of you and all of your accomplishments, and we are looking forward to you coming home and doing amazing things for all of the people that need you.
We love you. Can't wait to see you.
Love you.
Bye.
Bye.
Hello, Fallon. Congratulations on your well-deserved success. Dr. Fagin, you've persevered, and I am excited to see you continue the wonderful work that you do. I'll always be in your corner, and I am proud to call you my friend. Love you.
Congratulations, you guys! Best of luck! This is Dr. Bessler, Schmidt, Makowitz, and Keaton.
Hi, everyone. I wanted to say congratulations to the outgoing class of 2020. As the recent graduates, Anna, Dodie, and I wanted to share a few pearls of wisdom with you guys. And plus, I couldn't help but share some Star Wars. So, of course, this is the perfect opportunity. So what a crazy year has it been. I won't go through all the things that happened last year. You guys are living it. And although it is definitely a strange time, graduates, you're no stranger to this. You guys have been put on rotations, pulled off rotations, worked short hours some months, and worked really exhausting hours others. You've worked with attendings, with dozens of years of teaching experience, and with attendings fresh out of training. You've experienced doing rotations in the wealthy suburbs of Michigan and in the disadvantaged community clinics in urban Detroit. And you got to see the kind of response different clinics have in response to society-altering events like the coronavirus. For better or worse, I know I have. And here, graduates, is what really sets you apart. It's the ability to roll with the punches and make the best with what you have. It's the vast diversity of experiences your training has given you that will make you so ready for your future as attendings. I'm not even 1 year off of training, but let me tell you, it's not something to take for granted. I know you guys are eager to go outside and enjoy the beautiful weather, so I'll keep this short. I thought I'd just give a few tips to our new attendings and fellows. One, like I was talking about, be flexible in your methods, but keep your goals resolute. Know your values and stay true to them. Your boss will love you for it. Two, be humble. Graduates, I know you know a ton of psychiatry, but it's a drop in the sea of everything there is to know. Keep smarter people around you and learn from them. And lastly, and this is more of a selfish one, learn how to effectively do your therapy within your medication reviews. If you don't know what I'm talking about, talk to your attending. Don't get me wrong, be a great doc with the medicine, but do your therapy, learn how to document effectively and efficiently, and watch those RVUs pile in. Congratulations to all of you for all of your hard work, graduates. You guys deserve nothing less. May the force be with you.
So to the class of 2020, as you are all so close to that light at the end of the tunnel and finally graduating from residency, I can't help but think of all of the hurdles that each of you has overcome to get to this moment. The many ups and downs experienced in med school and all the board exams, the expense of moving from one city to Detroit and now again house or apartment hunting and making new friends in a new city, and facing challenges and excitement in personal lives and creating new families. Working as newly minted doctors, do you remember the feeling that you got when you first got called doctor? And like Arvind said, you guys have worked hard, you've learned a lot, you've overcome a multitude of challenges in the program, and here you are, all faced with yet another challenge and having to celebrate this momentous achievement in your career and in your life by remote connection. But we are here to celebrate all of this with you. But from what I'm seeing right now in my work at the inpatient psych unit and in the psychiatric urgent care, I think that we're at the beginning of a mental health crisis, a crisis that doesn't affect just a certain area of the world or a unique class of people or a specific set of genes. But this crisis affects everyone all around the world and also affected your final year of residency, throwing what was normal out the window and a whole new way of practicing medicine, interacting with patients, and advocating for our profession. And additionally, as families, communities, and hospitals grapple with this pandemic of epic proportions, we've also started to bear witness to the conversations and protests of Black lives and how we face, internalize, and fight systemic racism. So we as psychiatrists are needed now more than ever. And maybe not in the ERs or what many would consider the front lines, but on a very close second line, tending to those who are now consumed by anxiety and full of concern or fear or are too overwhelmed to face this challenging world. To those who are desperate in their social isolation and loss of routine or loss of supports. To those who have relapsed and may now be full of guilt or shame or regret. Or those who have lost loved ones and who want to grieve, but cannot mourn in their normal ways. So psychiatrists all over the world have been called on to treat these invisible wounds, wounds that we know have long-reaching consequences over a lifetime and even across generations. So you are entering into this new world, into these crises as new graduates. And let me assure you that you are well prepared to evaluate, listen, and treat your new patients and to advocate for them. So in conclusion, Dr. Fagin, Dr. Lister, Dr. Schmidt, and Dr. Keaton, we welcome you as colleagues, we congratulate you, and we look forward to working with you as we face challenges like these together. Thank you.
Hello, Andrew, Fallon, Danielle, and Peggy. Congratulations. You have all come a long way. As you prepare to take off the training wheels for good, it is important to find your niche, whether that might be working in an inpatient setting or treating older adults and children in outpatient. As you make this transition into your new role as fellows and attending psychiatrists, you are making that final decision for your patients. In psychiatry, many things can appear quite nebulous, but trust your gut instincts when making these decisions. It's okay to have some anxiety during some complex cases, but focus on staying poised and confident with your decision. There's nothing wrong with being inquisitive, and don't be afraid to ask questions or lean on more experienced colleagues when times get tough. Lastly, remember to find time for yourself within your busy day. Doing something that you truly enjoy can make your day go by fast, but at the same time can lead to burnout. Give yourself an hour a day for yourself to unwind and spend some time with family and loved ones. Congratulations, class of 2020. You are officially Authority Health alumni. Wishing you all the greatest success in your professional endeavors and looking forward to reconnecting at future psychiatric events. Thank you.
Congratulations.
Congratulations, guys.
Congratulations to Andrew and Fallon on reaching this new milestone.
I wish you much success in your new careers.